Good evening. Welcome to another edition of Sound Health on Lagos Television. I am Olasumbo Modupe. The World Health Organization recently issued a red alert on the Chikungunya disease outbreak, as well as the NCDC's alert on dengue, mpox, cholera, as well as other vaccine-preventable diseases. Why are we seeing a rise in these diseases, and what are the preventive measures to prevent further spread? Stay tuned, the conversation begins after this break.
Kamal will die at 49. Lucy will die at 52. Ashley will die at 57. Fatima will die at 59. Ethan will die at 63. A privileged few will be healthy enough to live sometimes decades longer than others, particularly those with access not just to healthcare, but resources like housing, education, and jobs. This is what health inequity means. To change this, we need to be all for equity.
The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Oladipo Kolawole, an associate professor of infectious disease, molecular virology and genomics with the Department of Microbiology, Adeleke University, and founder of Helix Biogen Institute. And he is going to tell us what exactly is the Chikungunya disease and other disease outbreak the NCDC issued an alert for, a red alert for. Good evening, Dr. Oladipo Kolawole, and thanks for joining us.
Good evening. Nice to be on Sound Health again today. Yeah.
All right, Dr. Oladipo, let us look at the red alert issued by the World Health Organization before we come home. The NCDC also issued its own red alert. Why are we seeing a rise in these outbreaks?
Well, some of the time, one thing that we should know is that climate change has a role to play in diseases like this. When we talk about chikungunya belongs to the arboviruses. Arboviruses are arthropod-borne viruses. It means these are pathogens that you pick from mosquitoes, but there are specific mosquitoes that transmit arboviruses. For instance, we have Aedes aegypti, Aedes albopicus. It's not like the normal Anopheles mosquito that transmit malaria. So, and when I started with climate, if you look at the season, when we have the season that is wet season, so you can have more breeding sites for mosquitoes. So it is easier for the vector to be more than expected because of climate. So, and also one factor that is responsible is global travel, because people are traveling from one part of the country to the other. So if someone is a carrier and travel to an environment where the vector is existing, the vector can now pick it. And poverty also has role to play. That is proper hygiene. When we have a place where the environment is dirty, we have breeding sites for mosquitoes. So there is chances that we have high rate of these pathogen. It's not about chikungunya. Dengue is one of them. Yellow fever is one of them. Zika virus is one of them. And one thing that is very, very funny about it is most of the diseases has vaccine, like yellow fever has vaccine. There are some countries that have approved chikungunya vaccine. Dengue vaccine is very, very complex because we have serotypes in dengue. And one funny thing about dengue is that once you are infected with a serotype, you are not protected against another serotype. So scientists are working extraordinarily to seeing that we have a good vaccine that can cover all these. So climate change is one of the major factors. Then we have what we call underdiagnostics, majorly from us like this. When we say underdiagnostics, it means that the presentation of all these pathogens, they present like malaria-like. So most of the symptoms are malaria-like. And because it's not something that is regularly discovered or reported, so when you go to the clinic, they will not be looking at that line. The first thing they want to do is to treat you for malaria or test you for malaria before now moving ahead to know that you are not responding. So further tests cannot be done. So what they do in advanced country is that they have a panel of study of tests rather for anybody that is suffering from febrile illness to rule out dengue, Zika, West Nile, malaria. So at a go, you can quickly pinpoint that this is the disease that this person is suffering for. So I just gave a background and trying to say that climate change is one factor because seasonal, and that's why you see that those diseases, the outbreak always come up in the rainy season, wet season. You can't hear much about them during the dry season because the vector is not around that time.
All right, for chikungunya, you said mosquito is the main carrier. Does this apply to dengue? Apart from dengue, there is also an outbreak of mpox, measles, yellow fever, cholera. I know those are not transmitted by mosquito.
Mosquito. Yeah, they are not transmitted by mosquito. They also have their own pathway. Let's look at cholera. It's a Vibrio cholera. He is an organism. That one is a bacterium. It's not any more viruses like chikungunya or dengue. So I would still say that as at that age now, you can see that there is cholera vaccine. People need to be vaccinated. Most of all these diseases are vaccine preventable diseases. So it's because the acceptance rate of vaccine is very, very, very high. I don't know that recently there was a work that was published in Global Lancet some couple of weeks ago that has to do with looking at the acceptance rate of vaccines in Africa, and Nigeria also examined. You can see that there is a proposition based on the mathematical modeling, that a lot of disease will spring up because the rate at which people are getting vaccines have reduced because of mistrust, misinformation. So most of the diseases we are talking about, either yellow fever now you have a shot, you are protected for a long period of time unless you need a booster dose. A cholera, Vibrio cholera that causes cholera, there is a vaccine for cholera too. People rarely take the vaccine. So if we can look at the environmental factor, because a dirty place, because cholera is transmitted majorly by flies too. If you have a contaminated food and you have it, you don't eat it, it flies. So you see, controlling the vector is number one. Then proper hygiene, having a good hygienic condition in anything we do, will allow us to live a better life that is free of disease. So all the diseases we have mentioned, they have different pathogens. Mpox is viruses too, and its own transmission pattern is quite different. So we have seen Mpox for a while, although it's something that there are no we widely use vaccine for it, but work is ongoing to ensure that things are done appropriately. I know some other countries in West Africa are actually battling with mpox now. And like I spoke the other time, that if we are looking at global travel, somebody is traveling from one place to the other, that the disease is occurring. So there is a high chances of transmitting the disease. And that's why our port authorities, either at the airport or the land port, have some things to check. The only truth about it is that, do people really declare what they ought to declare? Yeah, because they will say, oh, do you have a headache? Did you visit any other thing? Everybody say no. At the end of the day, if the person is not even it's just at the incubation period, you understand, it may not be showcasing the clinical signs. So it's after he has declared all those things that the clinical signs will now start manifesting based on the pathogenesis duration for that pathogen. So these are things that we need to look into. This kind of sensitization too is also good for the populace so that they can know and be aware of what is going around in the society.
Okay, again. I know the health status is expected to be private, but the private health status generates into the public health. Because you
Yeah.
mentioned that most people still conceal symptoms, their health history, and all that, let us quickly know now. Maybe it could also be as a result of low awareness. Most people do not know the symptoms of these diseases.
You see, one thing I do tell people is that there's something we call clinical diagnostics, laboratory diagnostics. So for clinical diagnostics, we can rule out some certain ailment based on clinical signs that, okay, it's likely to be this, it's likely to be that, it's likely to be this. But the truth about it is that that is why your doctor will take your sample and send it to the lab. So it's a lab that will confirm what the doctor is suspecting. Then an appropriate prescription will be done for you. So what we need to do majorly in this setting is that we should strengthen our diagnostics, laboratory diagnostic capacity in the country so that it is not until we have an outbreak that we'll be running up and down. You know, during the era of COVID, we have a lot of investment in laboratories for the molecular diagnostics. After COVID has gone down now,
It's
you
back to
at least see
status quo.
some of those investments really working because it's something that we should be ready. That's what we call pandemic preparedness. Not that until we have the outbreak that you see, I talk about it that even for NCDC, they are doing great. We should have regional labs in all the 6 political zones that it's easier. Then there should be at primary level too, going down to local government, there should be some small labs that they are partnering with so that it's easier to coordinate. So we don't wait until there's an outbreak somewhere, then we'll now be sending a response team to that place. It means we are already alert. So we need to ensure that we have a correct diagnostics measure in place and invest more because health is wealth.
All right, quickly touch on those symptoms, Dr. Oladipo. Let us know the symptoms of chikungunya as well as dengue, mpox. Just run through them so members of the public can
Okay.
be enlightened.
They are all arboviruses. And one thing I've known about it is that they have a wide range because some of time it could be like mild or flu-like symptoms, and it's if not well treated on time, it could lead to what we call encephalitis or hemorrhagic fever, because that's why we call dengue as dengue hemorrhagic fever. What I mean by dengue hemorrhagic fever is that it means at all the body orifice you'll be seeing blood coming out. That's it. That's how life-threatening it could be. And some common symptoms that is common to all of them is fever, headache, myalgia, that is muscle pain. We have joint pain, we have rash, and some of the time, some severe cases actually may involve confusion, may involve seizures, may involve paralysis. Some of the time, it may even involve coma. So we have seen some arboviruses, like they can cause meningitis. Meningitis. So these are things for chikungunya. It causes more joint pain. That is arthralgia in adults. You know, for yellow fever, it causes jaundice, liver damage. Some of the time, it could lead to gastrointestinal bleeding. It means the intestine, the gastro, that's the feeding, the digestive part of the body can be bleeding. And we have your chronic fever. And, you know, like dengue now, dengue specifically can cause fever, headache, muscle pain, skin rash. Then we have what we call hemorrhage or hypothalamic shock. So these are just some medical terms that I have. But we have what we call asymptomatic infections. Some people might be infected and experience no symptoms or mild symptoms. In some years past, I have done some work that I've screened out for serological study in Ogbomoso of people who are the carrier of this pathogen. And I discovered that a quite number of people has IgG, IgM towards dengue, Zika, yellow fever, despite they are not been vaccinated. It means one way or the other, they have been infected with the virus. It's because the vector is around us. So these are some of the clinical signs that can be seen. So it is until this clinical sign is seen and sample is collected and is laboratory-wise investigated that can now be confirmed that this person is suffering from either chikungunya, dengue, yellow fever, Zika, Mpox, and every other thing, as they might find out from the investigation.
Are any of them treatable?
Yeah, they are treated symptomatically. So once you have headache, they give you what to use for your headache. When you have joint pain, they give you. So when they need to work on your electrolytes, every other thing, as the symptoms is occurring, they treat it. So that's why I say it is treated symptomatically.
All right. I know dengue, mpox, and cholera, as well as some other diseases, are in Nigeria. Is chikungunya in Nigeria? Can you confirm that? If it is not in Nigeria, what are the preventive measures we need to start imbibing?
Yeah, chikungunya. There is evidence of chikungunya in Nigeria and dengue.
Okay. All right.
Because studies have shown for a long period of time. Yeah, chikungunya fever is endemic in Nigeria because it's been long. I've casted quite of people that have worked on dengue, like Professor Tomori has worked on dengue from early 80s, Professor Fagbami, Professor Hadu, and late Professor Olaleye from Virology, and Professor even Sunday Omilabu from LUT there. All of them have worked on it. They are evidence. So dengue, chikungunya, all of them, they are endemic in Nigeria. So that's why I said that some of the time, because their presentation is like malaria-like, so we have what we call underdiagnostics and underreported. So, and that is why you can see that NCDC is putting them on red alert. So when you see a case, don't just look at malaria again. You can move your test further for that. So, and Mpox is also have been reported in part of Africa too, and Mpox was formerly known as monkeypox before we have it, and the one seen in Nigeria belongs to clade 2, and we experienced an outbreak in 2022 to 2023. So those diseases are there. Once there is an environmental condition that favors them, we see them being manifesting in the population. And that's why we have emerging and re-emerging infectious diseases. So they're already existing, but now they are still showcasing again. So we need to be red alert. So the only way that we can curb this is one of these what we are doing, community sensitization. We sensitize the community. Then we strengthen our laboratory diagnostic capacity across the nation so that we can have a perfect and accurate diagnostics from everything. Again, we need more funding from government and private organizations for our research institutions to do more studies so that we can understand the transmission dynamics of this disease pattern. And when we have understanding of them, according to season, according to everything, so we can put all measures in place in order to prevent the outbreak of this disease. And more funding have to go into development of vaccines and therapeutics that can solve our own problem, while we are not waiting for one organization to donate to us, whereby we take responsibility of our health in our hand. And that is exactly what I will suggest to Nigerian government.
All right, your response reminded me of a recent report by the Commissioner for Health in Lagos, Professor Abayomi, where he said 95% of cases treated as malaria in Lagos were actually not malaria. So we need to be more intentional about our health. When we see mosquitoes around and all that, we need to keep ourselves protected. What should members of the public start doing to protect ourselves?
Yeah, one of it is that I will talk to travelers first. If you are a global traveler, whenever you are going to any country, first of all, understand what disease is endemic in that environment so that you can get appropriate vaccine before going there. And when you come back home, you will now be having an imported case or imported cases of diseases from other parts of the world. Then to our people who are not global travelers that travel from one part of the country, our health is very, very essential for we to take good care of it. So let's take care of the vectors. If we can take care of the vectors, we have already solved the problem because prevention is better than cure. So let's ensure that we don't have a breeding site for any form of mosquito because our people out there, they are not trained as an entomologist to never know that this is an Aedes aegypti, this is Aedes albopicus, or this one is Anopheles mosquito. So, this mosquito in this area, you can't identify them. So the best way to do is to get rid of breeding sites of mosquitoes because we should be careful the way we use mosquito repellent because we are having resistance to repellent by these mosquitoes. So the first thing to do is to get rid of the breeding site of all mosquitoes. So once we don't have the breeding site, then we can reduce them drastically so that the level of mosquito insecticide that we are spraying, we will not have much impact in our environment because we have to make our environment safe for living. And because all materials we're using now should be eco-friendly. And that's what the SDG is really telling us. Then all our people, like what the commissioner of Lagos State rightly said that has made mention of it, they should do a proper laboratory investigation before commencing treatment for our patient. So majorly, if your hospital facility does not have, partner with good laboratory that can give you a very good result, that you can make a very clinical decision that will have a great impact on the community. So I think these are the advice I can give to the general populace. And to all my co-researchers, let's go back to the bench, let's go back to the lab to do more study, hoping that the government will yield to us, give us the money to do the work, because outside there, their government is giving them enough money to do the study, and that's why they can find solutions to the problem they have in their country.
All right, clear breathing site for mosquitoes, adequate funding, proper diagnostic, and unlimited research is the way to go. Dr. Oladipo Kolawole, Associate Professor of Infectious Disease, Molecular Virology and Genomics with Department of Microbiology, Adeleke University, and founder of Helix Biogen Institute. Thank you so much for your time and expertise on the Chikungunya disease, dengue, mpox, cholera outbreak in Nigeria.
Yeah, thank you for having me on the show. Thank you for giving us the privilege to enlighten our people at home more on this. Thank you so much.
You are most welcome. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. Whether it is a red alert on Chikungunya disease, dengue, mpox, yellow fever, measles, and diarrhea, you need to report symptoms early enough to the nearest health facility. Do not self-medicate. Remember, not all cases of fever and malaria. See your healthcare practitioner for a comprehensive diagnosis. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television #SoundHealth. A sound health is a sound mind. Make healthy living your choice.